Doc, we only got about 17 minutes left, and I want to get to some of on the other side of your or the other hat that you wear because you're a chiropractor. And just a little history, Dr. Falk. He's been a chiropractor for 36 years in Groton. He's got a wife, Susan, son that's a plumber, by the way. He's got a daughter that's
nurse at Yale.
A nurse. So he's raised a beautiful family for sure. He's a fellow in the Acupuncture Society of America. Had a former radio show years ago, The Back Talk on WSUB. He's a representative of Allied Health Professional, Southeastern Connecticut Task Force in 1998, an IME physician, MedSource Incorporated, New England Independent Quality Exams Incorporated. He's had numerous postgraduate classes related to chiropractic techniques, nutrition, etc. So being with that very, very formidable resume, being a chiropractor, do you look at health and disease differently than a medical doctor? And is there still great debate between the MDs and the chiropractors?
As far as the debate, the younger medical physicians coming out are much more open-minded to chiropractic. Some of the older ones may have some questions, but I think if they look at the chiropractic education and what we do today. In fact, years ago, I sent a patient to one of the neurosurgeons at the hospital. He wrote me a little letter back. He says, "You and your colleagues are much more in depth at evaluating and treating back problems than most of the medical doctors." And that was from a neurosurgeon. So I felt good about that because we tried to do a proper workup examination. As far as other things, difference between medicine and chiropractic, 80% of medicine is test. We're going to do this blood test, we're going to do this CAT scan, we're going to do this MRI, we're going to do this, we're going to do that. Only 20% of medicine is treatment. 80% of chiropractic is treatment. So that is a big difference. As far as cost, we know that we have a tremendous healthcare crisis. And I always tell people, you can never ever treat enough symptoms to correct the cause of a disease. We in chiropractic try to treat a cause of a disease. If you had something happen when you were very young, it's mechanical. We try to fix the mechanical part of it. If it can't be totally fixed, what can we do to maintain it? And then re-educate your postural exercise habits to do that. On the other half, medicine, most of their treatment is drugs, as we know. In fact, the life expectancy in America, according to the World Health Organizations, we rank like 17th or 20th of the industrialized nations. But I don't fault medicine for giving a lot of drugs because most people who go to a doctor, what do they want? They want a quick fix. Pop, pop, fizz, fizz. Oh, what a relief it is. We don't have headaches because we have a lack of aspirin. We have headaches because there's generally a muscle contraction problem in the back of the neck, which causes the most common type headache. So we as Americans want quick fixes, and that's not good for our long-term health.
So somebody comes to see you, you pop a few bones and stretch them out a little bit?
We might stretch them out. As far as popping bones, that's a characteristic chiropractic treatment, joint manipulation. I've gravitated into more of an instrument adjustment. In fact, let me show you what this is here. This is an impulse instrument. It's an impulse IQ. There's a computer chip and an accelerometer in here. And what it does, it actually senses joint motion. The key is not a bone out of place, as we have thought in chiropractic and many patients think. It's actually a joint that doesn't move properly with the place it's in. So by unlocking that joint, we reestablish neurological and circulatory patterns, and that neurology goes back into the spinal cord, up to the brain, and back down. And it's amazing that those little nerves that come out of the spine, you know where they go?
Brain?
The nerves that come out of the spine, they come from the brain, they go down. Do you know where they go?
The feet.
Everywhere. They go down the leg, the liver, the kidney, the bladder, the spleen, the heart, the lungs. That's the importance of the properly functioning nervous system.
Now, is that gun that you just showed me, is that acupuncture? A type of acupuncture? Or what does that exactly do?
The instrument unlocks the joint. There's different styluses for it. We can reset muscles.
What's it feel like?
Like a thud. But the computer chip in there, the accelerometer, and that's why they charge $5,000 for the instrument, believe it or not, and I've got 2 of them in the office. They've hooked people up. Most of this was done in Europe from Dr. Koloka, a chiropractor in Arizona, where they put different probes on the bones, on the muscles, and they would adjust people with that, and they would see the oscilloscope do different things. So we know we're getting a neurological response when the spine is adjusted.